Good morning, Muscatine. Happy Wellness Wednesday. It's my favorite day of the year. As always, I want to start off by thanking our sponsors, Hy-Vee, Unity Point Health, Trinity Muscatine, Muscatine Power and Water, Becky Insurance, Toyota of Muscatine, Rivo Plumbing and Heating, Impact Fitness and Nutrition, Suntan City, Lutheran Living Senior Campus, Impact Life Blood Center, Harper's Cycling and Fitness, and our two newest ones, Muscatine County Fair and the Bayer of Muscatine. If you all saw last night, or maybe you went out and joined, the lip sync battle was last night in doing sales at the Mississippi Brew for the YMCA youth and teen programs. So hopefully they had a fantastic time. I would love to hear what the numbers were. I'm very curious. But always, Tony Tone always has a great time. So happy that was able to happen. This Thursday is the Start at Muscatine, and that's going to be at 5 o'clock at Proof Social. So if you're a small business owner, an entrepreneur, or possibly looking to start your own, this is a really great opportunity for networking and meeting and greeting to find the people for the correct resources that you need for your support on your small business or wanting to start one. So that is 5 o'clock, and that is at Proof Social, and this is something that the GMCCI does. So Start at Muscatine, it's the third Thursday mixer. After that, on Thursday, head over to Salvation Army at 7:30. So if you did not know, the Bach family, Greg and Liz Bach, are moving to Michigan to continue on with the Salvation Army. So we are doing a fun kind of open house for Salvation Army, getting to see all the new updates, and also, and I learned this the other day, that you can actually rent out their gymnasium. So I had no idea you could do that, so I thought that was kind of neat. But this is an opportunity to see all the amazing new updates and to say farewell to the Bach family. So it's open to the public at 7:30. They're going to have cake, drinks, they may have some snacks, but it's a great opportunity to say goodbye to such a fun family that has made such a great statement into Muscatine these past few years. And then this Saturday is the MPW Customer Appreciation, and that is from 10 to 2. So learning about all the utilities, what they offer there, being able to, especially if you're new within Muscatine, this is something that you can go to just to kind of create a great offspring of meeting the people that will help you within Muscatine. So 10 to 2, there's going to be lots of activities, displays. You can actually take a tour of their bus. There's going to be some free food and awesome prizes. Prizes that also include a 65-inch TV and then up to $500 in appliance gift certificates. So I think that's a really great opportunity to go to. So 10 to 2 Customer Appreciation Day for MPW. So today, as you can tell, I'm not in the middle of a grocery store. So today I'm at Unity Point, Trinity Muscatine, and I have two amazing guests with me today. I have Christy, who is the director of Trinity Muscatine of Public Health, and Holly, who is the clinical manager. Good morning.
Good morning.
That was a lot to say. I got everything, so we're good. So introduce yourselves and tell us kind of quick about what you do here and what brings me here today.
Yeah, so as you mentioned, I'm Christy Roby, director of the Public Health Department here at Trinity Muscatine, and Holly Barrett, our clinical manager. Holly oversees a lot, especially emergency preparedness at Public Health, and that has been consumed, as we were talking earlier, our last 2 to 3 years. So we're excited to be here with you today because we're going to talk a little bit more about our services that we deliver, but specifically we're going to hone in on our sexual and reproductive health clinic that we have here on our Trinity Muscatine campus. So we are Trinity Muscatine and the County Board of Supervisors and Board of Health. They have to provide, our county has to provide essential public health services. They have subcontracted with our hospital since the early 90s to do that. So we are a department of the hospital. So we're Trinity Muscatine Public Health Department, and we deliver those essential public health services along with additional health and community services that meet the gaps and needs of our county.
Okay.
But today, our big focus is around promotion, protection, and prevention.
Yes.
Those are the 3 Ps of public health. But we're going to talk to you specifically about our, what we've called traditionally family planning, but we're trying to play with the wording a little bit because family planning might not meet the needs of all audiences. It is sexual and reproductive health is really what we're offering, the services. And these are services that we can offer to adults, teenagers, and so, and it's family planning services that are confidential. And we have financial assistance that we can provide. So
Oh,
if somebody
good.
isn't insured, they don't have insurance, and Holly can talk to you a little bit more about that. We have additional programs that can help them with that access.
Okay.
And we also, as an organization, as Unity Point Health, within our public health department, we want to always ensure that we are providing inclusive care. So we make sure that we offer that safe and quality care offering. We're always in the space of health equity. We're dedicated to making sure that individuals have access to health care that are part of the LGBTQ plus community. And this is Pride Month, so we want to make sure that the community is aware of that. We are inclusive and can serve all individuals. So now I'm going to pass the mic over to Holly, and she can share a little bit more about our sexual and reproductive health services.
Thanks, Christy. So it is very important for us to make access to health care accessible to everyone, no matter their income or their specific personal situation. We want to be there for them and provide them the support that they need. We pride ourselves on being confidential, as Christy said, low cost, some flexible costs in there to help. And our services, as she stated, focus on being preventative and helping people find their way. What a lot of people don't realize at public health is with sexual and reproductive health, we offer a lot of services around that for ages, for young teenagers to older adults, to make sure that they're getting their health care needs. And we're always promoting for them to provide a primary care doctor to make sure that they're getting ongoing services that they need. So setting people up for success is one of our key goals. We also know that navigating the healthcare system is challenging, so making sure to provide a safe local referrals for that ongoing healthcare is another thing that our staff really hones in on. We want easy access to annual exams, pap smears, breast exams, and along with education, a lot of education. Our team really feels it's important for folks to understand facts and not just reading off of the internet where they find on sites, but really hearing from a professional. This reduces the spread of STDs and increases pregnancy prevention awareness. We offer several types of birth control that the patient can choose and have a say in what works best with their lifestyle. And our staff is highly skilled at explaining what the differences in the birth controls are, if there are side effects, timing, and discussing their life choices with them to make sure that they make those right decisions on their birth control. I also just want to make mention that June is Men's Health Month. We would strongly encourage men who don't always put their own health checks. They tend to more so go to a doctor if something's wrong. But preventative care is important for everyone, so getting those screenings and clinical wellness checks are very important for men as well.
How often do you recommend to do wellness checks?
At least annually.
Okay.
Assuming, you have no other symptoms or signs or concerns or pains. But yes, at least annually, just to get a thorough check and make sure everything is good and hasn't changed from the prior year.
Okay. I would say my husband has done his, so I just had to make sure that he was actually going as much as he should. So with all the different services, can you kind of go into more about the sexual and reproductive services, what all that entails?
Sure. Muscatine County, for the, we want to make sure that sexual and reproductive health is out and broad to all of Muscatine County, including any surrounding cities. Rural health equity is a top priority for us, and it's especially important for everyone to have access of every gender and identity. We are going to offer a variety of screenings and education of the community, whether it's in our clinic or off-site. We host and participate in a wide variety of events throughout the county, whether one of our partners is hosting an event or it's us coordinating and putting on the event, or even sometimes special days designated to serve specific populations or clinics at public health. Again, counseling, education, and referrals for other care that's needed is a large part of the demand. Our staff does frequent presentations for schools and community groups covering adolescent health, birth control, STD prevention, teen pregnancy prevention, and discussing sexuality and consent. So for our team, it's most important to get that education first and foremost to help people be aware and understanding their own personal situations and what would be of greatest importance to make sure that they stay healthy and informed.
Wow. Okay. So I love the fact that you just kept continuously saying, you know, the education is the primary. What age do you start kind of taking the education towards them?
So we do have programs within public health that start within middle schools.
Okay.
And we have specifically trained individuals who follow programs that is going to go into the schools, and they're going to educate children on consent and learning, starting to learn about sexuality and starting to learn about the decisions they make and how they impact relationships and their own health safety.
Okay.
So I don't know if you would want to expand on anything on that.
Yeah, I think that is right on. Just sharing that we're going in and doing that preventative. We talk to kids. We use an evidence-based curriculum
Okay.
that is required through our funding, and so we're going in with that with the schools, and we have the schools' partnership in that, and they review the curricula as well. We let parents know we're doing this. They get a letter sent home. We always want parents to participate, and if they have any questions about the curricula or what we're doing, we want them to lean into that. We
Good.
want to have dialogue with them about that. As Holly said, I think the biggest focus, especially in junior high, are about healthy relationships. What does consent mean? And as we get into the high school ages, it's more of that building on top of if you don't want to be pregnant, we will educate them as part of our curriculum. The only 100% way is abstinence. And so we talk about that, and then we talk about other options that are available if they choose to make that decision. And so it's important because we don't want teen pregnancies they were very high, and they've dropped, I would say, over the last probably 10 years, and we want to keep that trend going in that direction. Mm-hmm. One of the big things we do when we're in there and doing the prevention education is we let them know we have this clinic that is accessible to them. We want youth to know where they can get access. We talk to them about having a trusted adult to talk to. Not every kid has that situation.
Yep.
So we are a safe space for them to come to and receive that care.
And all of this information, I'm pretty confident, obviously school nurses, guidance counselors, so if they maybe aren't comfortable coming to you just yet, at least you're able to already have that
Yes.
information there at the school. Then it's the encouragement of an adult support
Yes.
to come here.
Yes. Youth having that connection to a trusted adult, regardless of who that trusted adult is key to their success.
Yeah.
So, definitely.
That's amazing. So what's the importance of having access to family planning for the sexual and reproduction health services?
So it's important to have access to do these health clinics, to do vaccine clinics. We need to make sure that folks understand that Trinity Muscatine Public Health and working with the Muscatine County Board of Health doesn't just mean Muscatine. It's the surrounding cities. And a lot of these areas that we have here in our vicinity, they're very rural. There's a lot of farming. Things are pretty spread out. So being able to go out to those cities and making specific plans to go out in surrounding areas, smaller towns, Conesville, Wilton, outer banks of Muscatine and Fruitland, we like to make sure that we're addressing those needs as well. So making sure that we are talking with our partners, with city leaders, making sure that we understand the gaps that are needed, and finding ways that we're capable of getting that health care out to those rural communities is highly important. Making sure they understand that there are a lot of resources within Muscatine County that can help them with preventative health needs or healthcare needs, or maybe virtual needs. There's a lot of changes in healthcare, and just making sure they also understand there's financial assistance when they do come to see us, things like assistance with travel to get to appointments. There is a lot of community support out there to help people get what they need, but they don't always know the questions to ask. So it is highly important for us as public health to continue to seek out that information, to seek out resources, understand how we can bring that to folks closer to them and reaching them in ways, not just TV, just radio, just social media, newspaper, any way that we can. They need those preventative healthcare services, and hopefully, stopping or hindering any future health problems by doing all these preventative screenings, education, and checks.
It is, like you said, it's as simple as a phone call. Don't go onto Google and type up, my symptom is such and such, what do I have? Because you'll get the WebMD of probably about 20 to 30 different options. So this simplicity of one phone call can make a huge difference just to help get them on that right track. And I love the fact that you continuously remind people it's Muscatine County. It's not just Muscatine. Growing up in Iowa City, I thought Muscatine County was just Muscatine. So it's nice that it's more than, it's Bluegrass, West Liberty?
Yes,
Yes.
West Liberty as well.
So Wilton, Fruitland, so you work with everyone within this, so I appreciate it. I'm sure you guys have a handful of different places going back and forth continuously. When it comes to the Muscatine Public Reach, when you outreach to these other communities and rurals, how do you play a role into that part? Is it just waiting for them to come to you, or do you outreach and continuously go out to different areas within the county?
We do seek ways to go out into the county. Like I said, those partnerships are essential for us. So, for example, in our clinic, and we've made a lot of new partners and continuing to grow, especially during the pandemic and during times when we had to pull on our partners and community leaders to understand where the people are in the community and what their needs are to get them vaccine or other information that they've needed. But we make sure that rural health equity, like I had said, it's very much a top priority for us. We could look at something like having a health or vaccine clinic at an event that's going on. Maybe it's a farmer's market. Maybe it's a Fruitland firefighter station where it's easier for somebody to walk to or bike to versus going all the way into town. So one of our jobs is to seek out those potential opportunities to see where are events happening that people may make that effort to go there anyway and learn about. We've also worked with United Way as well and Salvation Army, and we seek ways to, maybe do mass mailings to notify people of what's going on, or connecting with other local senior resources that they may connect with anyway. And without those partners helping spread the word of the importance of rural health equity, I think it would be a lot more challenging. So we do rely on them to help us out.
Good. Were you about to say something? Oh, okay. What other community outreach programs does Trinity offer on the topic of family planning and the sexual reproduction?
Sure. In our clinic, we offer quite a bit. We have a lot of services within the clinic that we focus on, and it's not per se within the clinic as well, but along with access to health care is access to insurance. So we have trained individuals who assist people to get signed up for insurance and help them through that lengthy process. And also some folks may be familiar with Hawkeye for Children's. We also do a program called VFC program, which means Vaccines for Children. So we are fortunate to be part of that program and be able to offer vaccines to children at no cost for the vaccines for them. We also have been focusing quite extensively, as you can probably imagine, with the pandemic, but also prior to the pandemic and continuing throughout, communicable disease investigation and contact tracing. We work in close partnership with the Iowa Department of Public Health to manage cases of residents of the Muscatine County and any incidents or events that may have occurred, or and doing that tracing and helping guide people through their medical or recovery journey through any communicable disease.
That is a lot of information. That is quite a bit. So where can people go to learn more about just within like family planning, sexual and reproduction? Maybe they just need to reach out to you for just about anything within public health. How do they learn more about this?
I'll let Christy take this one. And yeah, she can review all of the information that we have.
Okay.
Yeah, so thank you for having us here. And we do have, it's a plethora of services. And today was just talking about sexual reproductive health, from prevention to our interventions types of services that we do. But we have about 30 different service lines within our public health department. So we could be here for
a while.
Every show or
Yeah.
a while.
Chris,
So
we'll
that's
be here every Wednesday.
we're honing in on a service. But we want the community, I'm just going to emphasize again, we want the community to know that we have this clinic, and a lot of folks don't know that. Sometimes parents are like, my kid needs to get on birth control, or they need to go talk to somebody, or where do we go? How do we navigate this? Call us. Just give us a call at Public Health, and I'll give you that information. Or, men or women seeking some reproductive health care, or maybe somebody wants to get confidential STD testing. They don't want to necessarily go through their provider. That is an essential public health service. We do testing and we do treatment. So we want the community to know we are available in that space. But again, we could come back every Wednesday and talk about our 29 other services that we have. But if there's any questions, about any of the programs that we do, we're here on the hospital, I call it campus, right?
Okay.
Because we have the main hospital building.
Yep.
And then as an organization, we have a lot of little outbuildings. We're over at 1609 Cedar Street, right next to New Horizons.
Okay.
And you can call us at 563-263-0122. That's our main number. And ask whatever service you're needing. I mean, we are a one-stop shop. We might connect you to somebody else in community for the right service. It might not be us, but we can make that. We collect and connect the dots for community. So
we
can.
say, oh, sorry, we don't provide it.
No, that's
hang
not.
up.
No,
Yeah.
we would never do
No.
that ever. So our team knows, and there's a process. We have care coordinators that can help filter and help people navigate just general questions about their health or any needs that they might have in community. So we also have a I want to guide people to our public health Facebook page.
Okay.
It's Trinity Muscatine Public Health. That's how it's on Facebook. And we post things on there continuously, kind of real-time subjects. So let's say there is a recall on peanut butter. And so we put that information out there, the information on formula that we recently went through for children
Yeah.
and families, for infants and families. We put education information out about that in real time. So
Good.
we want people to go to that as a source of information.
And we did tag it, so it is actually in
Awesome.
there now. So
Awesome.
one-stop click.
Yes, that's awesome. And sometimes people are like, I don't have Facebook. I'm not going to get on Facebook. And that's okay. That's a really good boundary, actually, to have for yourself. You can still access, though, Trinity Muscatine Public Health on Facebook, even if you don't have an account. And I think
Okay.
sometimes individuals don't know that that is possible. So we want you to go to that as a source.
It's an open website, just like any other.
Yes.
Nice.
Yes.
I love
And
that.
if you have any questions, you don't have internet, you have a phone, or you can get to a phone, call us. Mm-hmm. So
Can people walk in?
they sure can.
Okay.
Yep. We're public health, and so Monday through Friday, we are in our clinic operations. We often work outside of those hours, but our clinic operations are 8 to 4:30, Monday through Friday. So folks can certainly stop by at 1609 Cedar Street, come to our patient registration area and tell them what your needs are, and they will get you connected to the right person.
Love. So
Yeah,
walk
yeah.
in, call in,
Yes.
Facebook message. Do you do Facebook messaging?
Yes, we
Okay,
do.
good. I was
Yes.
like, wait, I need to ask. So, I mean, multiple different ways to get a hold of you for
Yes.
just about anything. And you're saying from middle school all the way up to adults, no matter the age.
Infants. We have
Infants.
early childhood programs as well at Public Health.
Look at that, another
We
service.
do. We have
One of the 30.
30 services. So yes, we do have early childhood services all the way up to aging populations.
Oh, wow.
Yes.
Okay, perfect. So anyone, everyone,
Give
come
us a
in.
call.
And then make sure that you are doing your annual check-in once a year.
Yes, yes, most definitely. And I think, especially, we always want to ensure people, as Holly was saying before, that plug for access to health care. As a public health department for Muscatine County, our focus is to make sure people get connected to, as Holly was saying, primary health care providers. So, or some people might know, a doctor, whether that's nurse practitioner, PA, a doctor, medical doctor. We have a lot of medical facilities, healthcare providers in Muscatine County. And so we have a list of all of those healthcare facilities and can help people get connected there
Oh, nice.
directly. So because we work for Unity Point Health, we're not guiding people just to Unity Point Health. We are operating as the Muscatine County Public Health Department. So we're helping people get access to University of Iowa, Mercy, community health care that we have in our community, who also offers sliding scale fees for individuals who may not have insurance.
Okay.
And all of our Unity Point Health clinics, which we have many, we have a plethora,
Yeah.
and we have specialty care as well. So our team is well versed in knowing what all of those resources are, and we have clinics throughout the county. So Genesis is also in Durant. Poor Durant has, they have the best of all three worlds. They have Scott County, Cedar County, and Muscatine County that all
Yep.
touch them. So we do navigation for folks in that community as well.
So especially if I'm new to Muscatine,
Yes.
you're a perfect place to stop
Yes.
first
Yes.
to find all the resources that I need.
Yes, we can certainly do that. The other thing I'd like to give a plug for is we have a website where people can go. Let's just say you're new to the community, or you're trying to navigate. Your neighbor came to you and said, I need help with housing and I don't know where to go. We have a website. It's called lmcresources.org, which stands for Louisa, Muscatine, Cedar Counties.
Okay.
So lmcresources.org. And there are a list of, there's toggles of different services that people can navigate themselves from their own home
Oh, nice.
if they want to know where to go for care.
I didn't even know that this website. I love learning
Yes.
things every single day. I'm on this show. I learn something new every day. All right. Well, look at that. I have plenty of resources now that I can use,
You do.
or to help other people use.
Yes.
Well, I appreciate you coming on. Is there anything else you'd like to share with us?
I would say we would love to come back, you know.
Yes, please. You have
we certainly-
29 other services to talk about.
29 other services. I did an interview yesterday about the heat advisory that's going on. So we are in that space of prevention, and so reducing injuries and prevention. And so just being mindful during this hot weather, as we're getting used to it, making sure that you're staying cool, you're staying hydrated, staying in air conditioning if possible. Not everybody has access to air conditioning. So we want to encourage folks, if you have the ability to get transportation and or walk to cool shelters, you might decide, I'm going to go to Hy-Vee grocery store and walk around. And
it stays nice and cool.
Yeah,
in
it
there.
stays nice and cool. So just places like that. Our library is a great place to go to stay cool. So being mindful of that. And if there's any symptoms that you are getting concerned about, fainting, dizziness, severe headache, if it's a medical emergency, call 911. We have great responsive emergency medical services and our hospital here that can support. I've had an individual, a loved one, probably about 10 years ago that was here in our ED because they had a heat stroke. It started with heat exhaustion and it moved into heat stroke. And it was a pretty scary experience. So just being mindful, the CDC has some great resources to watch out for that.
Yes, as your nutrition coach of Muscatine, please stay hydrated, drink water, stay cool. Keep your pets inside, please.
Yes, please.
Keep the pets inside. Keep them just as cool, but water,
And
hydrate. Well, I appreciate you coming on. I loved all the information, and like I said, you have 29 other services to talk about here on this show, so I will definitely be seeing you again.
Wonderful.
I appreciate you taking the morning and hanging out with me, and I learned a lot, especially I've only been in Muscatine for a couple of years, so I love learning more and more. I had no idea that you had your own separate area. I thought you were actually here, so I love it. I'm learning, and I can continue providing this and sharing this with everyone else too. So thank you so much, ladies,
Thank
for
you so much
joining
for
me.
having us.
Well, my friends in Muscatine, remember, third Thursday, start at Muscatine at Proof Social is 5 o'clock tomorrow, and then at 7:30 tomorrow evening, please go to Salvation Army and say farewell to the Bach family. And this Saturday is the MPW Customer Appreciation. Starts at 10 o'clock, free food, prizes, and being able to learn more about the utilities that they offer. Well, until then, and I will see you all tomorrow, have a happy and healthy Wellness Wednesday.
Here at Toyota Muscatine, we're here to serve.
When you buy a vehicle at a multi-brand dealership and it isn't locally owned, it can be difficult to get information that you need.
That's why all of our trained salespeople are focused on one thing, getting you the best deal possible on a new or used Toyota.
And when you pick your favorite, we will help you with financing and maintenance.
We love helping our neighbors.
Come to Toyota Muscatine today.